So, just to get us started here, what are some of the most common mental health challenges that military veterans face?
Sure. So if we kind of take a step back for a moment, I spent a little under 8 years at the VA in the Bronx. So spent many years working with veterans across the continuum of generational and combat experiences. And there are a number of different areas where can be impacted. Uh, Generally speaking, by experiences with mental health challenges and psychopathology, but also in particular related to cultural elements in the military and what the military culture, how the military culture influences how we think and talk about the topics of health. So certainly in certain mental health presentations like mood disorders like depression, anxiety disorders like generalized anxiety, social anxiety, or specific phobias, and you see actually a pretty high prevalence dysfunction associated with trauma and post-traumatic stress disorder, both of which are highly prevalent in the military population.
So, we're going to get obviously more into trauma as well as anxiety. Now, you spent 8 years at the VA. Did you encounter, or what would be your take on physical injuries that have been sustained in combat that could be impacting function as well?
Sure. So there could be a range of different physical challenges that can be the product of either military experience or physical injuries that take place really at any time in someone's life. But injuries that are related to, let's say, neurological conditions, neurological injuries, things like traumatic brain injury that can be the result of things like IEDs, improvised explosive devices, can certainly be things that impact health and function, but then also physical injuries, things like spinal cord injuries, injuries to the pelvis or the hips that can impact your pelvic floor muscles or can impact your peripheral nervous system, can also impact response and function. So there can certainly be elements that can be the direct result of physical injuries that can impact health response.